Construction is frequently cited as having one of the biggest effects on health and safety hands. Recent studies have found that managing health and safety is challenging in developing countries. The main barriers to sound hands practices have been identified by research findings that are viewed from the perspective of construction contractors. The outcomes show a lack of commitment on the part of the government, as evidenced by the regulatory policy. Legal limitations that hinder the spread of reliable hands practices and reduce the operational effectiveness of government organizations responsible for managing health and safety. Analyzing potential solutions to enhance hands performance on construction sites. There is broad agreement regarding the sector's importance in both the social and economic spheres in terms of the effectiveness of the construction industry, managerial practices, and procurement methods. The industry is still thought to be the riskiest. The International Labour Organization, ILO, estimates that there are more occupational health and safety (OHS) risks than were previously recognized in the construction industry. Around the world, the construction industry's subpar performance is to blame for 30 to 40% of all fatal injuries, or more than 100,000 fatalities annually. Although governments and business associations in industrialized nations agree that the high accident rate in the construction sector needs to be addressed, poor safety records continue to impede the advancement of performance, despite the fact that many people support the implementation of a zero-accident policy. This is especially important for developing countries, where shoddy construction and a lack of proper recording and notification systems lead to a lack of reliable information on workplace accidents. Contractors that fall into the category of small and medium-sized firms typically dominate the construction industry when comparing emerging nations. Investigations reveal that these contractors do not pay much attention to their work, which results in a significant number of accidents and health problems. The management of health and safety on construction sites in developing countries may be impacted by a number of factors that have been identified. These include inadequate infrastructure, a dearth of hands laws, regulations, and legislation, low rates of worker literacy, insufficient notification and recording systems, competitive tendering, extreme weather, and corruption. Similar to many other developing economies, the building sector has suffered from poor hands management, which has had a negative impact on both the economy and society. The construction industry makes a significant contribution to both infrastructure and economic growth. The variety of hands issues that arise in the construction industry has led to a significant amount of research that pinpoints the key factors that enhance hands performance. It is frequently emphasized that the need for safety laws is crucial for reducing accidents at construction sites. Organizational safety policies are one or more additional important drivers. The Construction Industry Institute suggested increasing the frequency of formal safety meetings with supervisors and made the case that safety equipment is essential to reducing and preventing site accidents as 2 of 5 high-impact zero-accident techniques. Strategies for raising safety consciousness and effectively preventing accidents. It is believed that safety performance needs to be enhanced, and that safety audits and job site visits should be carried out. Since a worker's attitude towards safety is considered to be a significant contributing factor to accidents, it has been noted that improving worker education and training is a key element in improving hands performance. Many nations have developed and published their own performance management and safety program systems. The developed world's construction industries have identified and implemented key performance indicators, KPIs, and safety criteria related to hands. From the perspective of procurement, safety is also described as a crucial component of suggested regulatory frameworks. To describe and evaluate a company's safety performance on the construction site, a number of safety performance measures have been developed. The Experience Modification Rate, OSHA's reportable incidence rate, the lost workday rate, and the lost time rate are a few examples of metrics used to evaluate an organization's safety performance over time. Comparing corporate and project levels provides quantitative methods for enhancing safety performance. The most crucial company-related factors include management support, time spent on safety issues by the business safety coordinator, meetings with field safety representatives, informal safety inspections, safety training, and company safety expenditures. One way to identify various issues at the project level is to increase the experience of project managers, decrease team turnover, reduce worker fines, and increase budget allotment for safety awards. Finally, consumer trading organization will keep hosting new concepts.